Now, blue skies and blue seas await Greece, slowly welcoming back international visitors in time for the European summer. Tourism makes up more than 20% of Greece's GDP and around a quarter of its workforce. In the first phase, international direct flights are being allowed on the mainland and these popular islands, including Crete, Corfu and Mykonos. There's no need for quarantine if you're coming from the EU, Britain, the United States, Israel, Serbia or the UAE, and you're vaccinated if you're vaccinated or have a negative PCR test. There will still be targeted rapid checks at entry points with quarantine hotels for those who test positive. And just like the locals, you'll find bars and restaurants remain off limits, except for takeaways. Harry Theoharis is Minister of Tourism for Greece, and he joins us now. Minister Theoharis, great to have you on the show. A lot of countries grappling with how to handle tourism. Greece being bold about this, I think, and the message seems to be, if you're vaccinated in particular, then you're not a risk to others. Is that correct?
Well, yes, up to a point, but it's also a complete system that has 5 levels of protection for everyone, both our citizens, of course, but also anyone coming to Greece. So this is not just about the vaccination, it's about testing before you leave. In case you're not vaccinated. It's about targeted testing when you arrive, and of course isolation if you or your family, if you're positive. It's protocols, masks, the other things that we're used to by now. We have to keep social distancing, etc. And of course it's priority vaccination for people serving in the tourism industry. So it's a complete system that wants to keep a balance between international travel and safety.
Let's break down those individual pieces of this plan, and I'll start with just vaccinations. If you've been vaccinated with the Chinese vaccine, if you've been vaccinated with the Russian vaccine, does that still qualify for entry?
Yes, it does qualify for entry. It effectively means that you can skip the pre-departure test that you have to perform otherwise. So that's effectively the only difference between vaccinated and non-vaccinated people.
So even though those vaccines aren't approved or authorized in Europe, Greece is saying, look, it's good enough for us.
It's good enough for the risk-based approach that we're taking in terms of traveling. The risk-based approach, it's on an individual basis and not on a regional basis or a country basis. So we've waited with our doctors, this is based on our health experts' advice, that for the risk is minimal as far as international travel is concerned, that we don't need to impose both a PCR test and a vaccination certificate in those cases, yes.
Yeah, I mean, Greece is trailblazing here. A lot of nations, as I mentioned at the beginning, are struggling to decide how to operate. But at some point, we have to try to get back to some form of normality once more and more people get vaccinated. So you are trailblazing on this, which I think is very important. Just help us understand as well the rules that will apply to tourists. Will they be similar to what Greek citizens are currently facing in terms of restrictions travelling to different regions? I mentioned that some of the bars and restaurants will be closed as well. Is there any difference between being a Greek citizen in the summer and being a tourist?
None whatsoever. I mean, I want to be clear about this. We are applying the same health and safety. A tourist's life is as important to us as our citizens' life. So the same rules that are imposed for hygienic reasons, for the epidemiological reasons, will apply to everyone. We do not discriminate in any way whatsoever. So it's important that people understand this. We're hoping that things will actually be more and more liberalized as the vaccination programs throughout the world progress. But even if we have changes in the other direction, those changes will apply to everyone.
What's it going to be like? For those that are watching here and thinking, I'd love to go to Greece. I've been to Greece before. It's a beautiful country. I'm biased. I love the Greek islands. But if things are shut, if the country is still challenged, what's it going to be like as a tourist?
Well, let me say, by the 14th of May, where we're going to have the formal opening of our tourism season, restaurants will be open, especially outdoor parts of the restaurants. We already have the archaeological sites open. People have to wear masks, so this is not a normal summer. I mean, those restrictions still apply. You can still enjoy the outside. You can do hiking. You can enjoy the beach where you don't need to wear a mask. You can enjoy those things, but you still need to keep your distance. You still need to be, cautious about how we move about.
Yes, sun, sea and social distancing, that really is the message.
Yes.
You mentioned as well, a top priority is getting people that work in the tourism sector vaccinated. Can you give us a sense of your timing on this? Clearly it depends on supplies, but when people go there, will they know that generally they're being helped, provided services by people that are vaccinated too?
Yes, of course. We will for certainly guarantee that they're either very, very tested often or they're vaccinated. We're hoping actually that the vaccination program will actually accelerate and we will not need to vaccinate as a priority. We will open those ages, if you like, and people working in the tourism industry will have the ability to get vaccinated as a matter of fact, like the rest of the population. But if there is still supply sort of restrictions, then we will prioritize our people in the industry to vaccinate them as a priority.
Minister Theoharis, we spoke to Prime Minister Mitsotakis a few weeks ago, several weeks ago, I'll be clear, and we were talking about the challenges of handling the third wave and how your intensive care units are doing and your healthcare workers. Can you just give us the latest on how you're managing the current outbreak?
Yes, of course, we're trying to manage the best possible way. We see already the dent in the number of cases because of the vaccination progress. Every day we vaccinate enough people to lower the transmissibility by 0.5%. So that's an important factor that as the days progress bites into the disease. The situation in the hospitals is still tense. I don't want to deny that. We're still managing in sort of with a health system which is very, very much stressed, but a health system that's coping at the same time. So we haven't seen the overwhelming of the health system like we have seen in other places, but it's still a very stressful period for all our health personnel.
Yes, and we wish you all well, sir, and fingers crossed for a good and safe summer. Harry Theoharis there, the Minister of Tourism for Greece. Great to have you on the show.